Good evening. I'm Mike Slowey, one of the co-founders of Coastal Fertility Specialists, and tonight we're going to talk about um, supplements and is there a role for them in infertility care. So, something else just came up on my screen, so I'm going to click that out real quick so I can see what I'm doing here, and we're going to get started. So, an interesting thing would be, well, why should we care about supplements? Um, Well, about 87% of American adults take some sort of supplement. So that's pretty darn common, wouldn't you think? And as it turns out, I think this is important to keep in the back of your mind, it's an over $40 billion industry. So folks are making a lot of money off this stuff. The botanical portion of that, and we'll get into that a little bit more in a minute, were about 20% of the market in 2016, and now that's increasing by about 20% per year. There are over 85,000 supplements marketed in the United States at this time. So that's quite a lot of stuff out there for us to try to sort out. And I think the important thing is to look at the science of it. I mean, that's what it's all about. That's how we get babies. We get babies through the good use of science. And one of the common terms that are used in scientific studies that people try to interpret are terms like relative risk and odds ratios, the likelihood that something more likely is to happen. And people like to equate that with cause and effect. All right? Well, what does really cause and effect look like with odds ratios and relative risks? There are some very, very good examples in medicine. For example, I think all of us are aware at this point in time that smoking causes lung cancer. That relative risk is 103, not 1.03, 103. It's well established in obstetrics and gynecology that estrogen therapy all by itself can cause cancer of the lining of the uterus. That was established in the 60s and the 70s. The relative risk there is somewhere between 10 and 20. We know that long-term elevated cholesterol can cause heart disease. Relative risks there are 7 to 10. The risks that we're going to be talking about are all under 3. So I think that you got to take that under consideration. When people are trying to say, yeah, that causes this, causes that, no, take a look at the numbers. If relative risk is really not over 4, it's probably not super meaningful. Okay? All right. So let's define a couple of things. Number one, what are vitamins? Vitamins are a variety of unrelated organic molecules that occur in foods in small amounts, and they are necessary in these trace amounts for normal metabolic function of the body. There's a subgroup of that called essential vitamins, which are required in small quantities in our diet because our body doesn't make them. So that's what vitamins are. They are essential for their function, for our function. But then we have botanicals. These are plant-derived, crude drugs used to treat diseases. That's what they are. Now, what really happened that was big was in 1994, the Dietary Supplement and Health Act was passed by our Congress. A senator from Utah who received millions of dollars in campaign contributions from the supplement industry passed a bill that was basically written by the supplement industry. Prior to 1994, our supplements really were multivitamins and minerals, things that had established nutritional value. And they're safe when used in recommended doses. But after 1994, because of the industrial intervention, not only do we have vitamins and minerals, we also have botanical and herbal products, amino acids, and enzyme supplements. They do not have to have required proven safety. Let me repeat that. The Act of 1994 does not require proven safety. It does not require that any claims made on the label are accurate. The FDA can only be involved after the product enters the market and there are problems. And intentionally, and this still goes on today, the FDA budget is intentionally handicapped for this supervision. And all the advertising actually gets swept under the rug to the Federal Trade Commission, who's busy enough. All right. Now, what I want to do is go through what are actually some of the problems with supplements. Quality control, adulteration, safety, and effectiveness. So when it comes to buying supplements, the famous Latin term caveat emptor really applies. And that means buyer beware. All right. One of the few things that they were able to get passed in that bill is that the label must contain a sentence not intended to treat, diagnose, cure, or alleviate the effects of disease. Except that's what they're used for, right? When used improperly, supplements can be harmful. They can have unwanted side effects and increase the risk of surgery and anesthesia. When I was practicing in New Jersey, our OBGYN department at Inglewood Hospital had a rash of women having terrible bleeding at C-sections that resulted in emergency hysterectomies, so cesarean hysterectomies. And being the neutral person, being the reproductive endocrinologist, I had to review, I think it was 6 or 7 cases of this that happened in a very short period of time. Well, as it would turn out as we dove into it, every one of these women was taking a special herbal medication that was being culturally prescribed for them because it was supposed to help with the discomfort of pregnancy. But it's also a really powerful anticoagulant. So it was in fact not the doctors doing anything wrong. The patients were taking these supplements, and it led to them ending up missing a uterus. Fortunately, none of them died in the process. Now, as we look at the honesty of this, there was a nice review in 2009 of 443 websites of the 8 best-selling herbal products. 81% of them made at least one or more health claims, which you're not supposed to do. 55% actually just outright claimed they treated and prevented diseases. 52% omitted the required federal disclaimer, and only 12% provided references to back up the claims that they were making. Another study in 2011 from England demonstrated that the 51 most popular supplements in England, 75% had no key warnings or safety messages, especially about medical conditions, drug interactions, and side effects. Buyer beware. In terms of quality control, this is fairly entertaining. Inspections of some of these facilities routinely reveal very, very poor quality control. Violations for lack of recipes. Yeah, how do you like that? It's like grandma. Oh, I know what goes in here. My grandma was a very good cook, by the way, and a little pinch of this, a little pinch of that. Yeah, that's what some places are doing with your supplements. And, of course, unsanitary conditions. In one 2014 study showed 62% of the facilities inspected had violations, including not testing to verify the identity of the dietary ingredient. You'd think that'd be kind of important, right? No product specification for identity, purity, strength, composition of the finished product. So a lot of these places were just putting stuff together and didn't know what was in it. And that was verified by another study that looked at 44 samples from 12 companies. And these were, again, looking at herbal supplements. In one particular section, they looked at 12 different herbals, and only 2 of the 12 actually contained the DNA that was supposed to be on the label, of the plant that was on the label. 2 of 12, what's that, about 18%? My dad was the accountant, I'm just the doctor, so somewhere like that. 30 of the 44 samples in another part of the study had product substitution. So something else completely was put in there. 59% didn't even have the plant species listed. 33% found DNA that matched rice, soybeans, and wheat. And 20% contained toxic ingredients from plants like senna and feverfew. Lovely. Another quality control study from New York looked at 78 bottles of commercial herbal supplements from major stores. And 80% of those samples did not have the DNA for the herb listed. So the product that was on the label was not in 80% of the products. Fillers included rice, asparagus, and houseplants. You wondered what happened to your mom's plant that you gave her for her birthday. There you go. And then, of course, a bottle of wheat-free ginkgo biloba, and ginkgo is supposed to help your alertness, actually contained wheat, houseplants, and powdered radish. I don't know what you use powdered radish for. I cook, but I've never used powdered radish. All right. To me, one of the most dangerous things with supplements is adulteration. Many so-called all-natural products actually contain prescription drugs. The 3 dangerous categories are weight loss products, athletic performance products, and sexual health products. So in the weight loss products, the most common thing found is actually a drug called sibutramine, which was a weight loss appetite suppressant that was withdrawn from the FDA approval process due to problems with strokes and heart attacks. But yet, it's in supplements. Athletic performance drugs can be a nightmare. Amphetamines, male hormones, androgen enhancers, all over the place. You want to go down a rabbit hole, start looking in that literature. It's crazy. I just do not know how the very, very high-end athletes are able to cope with all of this. I'm a former swimmer, and I was formerly a world ranked swimmer at one point, and we didn't have to deal with all that other than the Europeans doing steroids. And that was pretty obvious who was doing it too. But now it's just crazy, and I don't know how they, at the top end, how they're able to cope with all that. And then the sexual health products, well, let's just put it this way. There have been over 700 variations of Viagra found in these types of products. And these variations are created so that standard assays looking for Viagra-like molecules don't pick them up. So there you go. All right. And people, oh, that's really not a big deal. Well, not knowing can be expensive. Going back to swimming, going back to my roots here, in 2008 Olympics, Jessica Hardy, an excellent swimmer, very nice young lady, was taking a particular supplement. It was an amino acid supplement, but unfortunately it contained clenbuterol, which is a beta agonist, which is cardioactive, and it also has anabolic, so steroid properties. She did not know it was in there. And so she got banned from the Olympics. She'd made the team and underwent a year suspension. And then, and some of you locally may remember, in the 2018 college playoff, 3 Clemson players were ineligible because of a product that they were taking. And I have no doubt that the Clemson program does their best to be as clean as possible. And it was probably just a contaminant that was in there. I don't think these kids were trying to cheat. But there it was. All of a sudden, those 3 guys couldn't participate. They were suspended. And that's a tremendous shame, because you work your whole life to get to a championship, and then you don't get to participate. And then safety. You know, everybody equates natural with gentle and safe, and the pharmaceuticals with foreign and powerful and toxic. Well, there's some stuff out there in the world that's pretty dangerous. A very common one is called aristocolia. It's been used as a medicinal for over 1,000 years, primarily in the Far East. It can cause problems with the kidneys, including renal failure, and cancer of the upper urinary tract. It is actually among the most potent carcinogens known. It's widely used in traditional Chinese medicine, and it also happens to be found in 78% of the liver cancers in Asia. Yep, gentle and safe. Now, something else that's really important are drug interactions. And so you got to make sure that your doctors, whether it's us or your primary care doctor, knows if you're taking something. Absorption can be altered, distribution can be altered. Very importantly, metabolism can be altered, how other drugs are broken down. It can be enhanced. And so there are a variety of them that can create problems with the very important liver enzymes, the cytochrome P450 enzymes. They're important for our steroid metabolism and everything like that. Other contaminants you may find that create problems: pesticides, heavy metals, bacteria. All of these are things that are found in the supplements. The FDA estimates that the supplements cause about 50,000 adverse events a year, primarily liver and renal. Here's an interesting fact. Supplements account for 20% of acute liver failures in the United States. It's hard to get another liver, folks. And 51% of the FDA recalls were dietary supplements that were adulterated with unapproved drugs. Again, that's when the FDA can come in, is after people have already been hurt. So, what do we think? There are many effective life-saving drugs that we use that comes from nature. Digoxin, quinine, salicylates, so like aspirin, Taxol, which is an anti-cancer drug, insulin, growth hormone, calcitonin, all of our hormones, antibiotics. Remember, the original penicillin came from fungus. And you know what? There's probably a lot more compounds out there that have not yet been discovered that are going to be incredibly helpful. But there is a large amount of scientific information available, but most of it is poor quality or very limited in scope. I think it's important to remember that basic science outcome does not necessarily mean a good clinical outcome, which is not necessarily what we see in real life. There's a big, big step between what happens in a lab with mice, cells in a dish, and what happens in you and me. And this is not meant to be a criticism of the investigators. It just is simply due to the complexity of dealing with complex compounds and complex organisms like ourselves. What the supplement industry preys on is this. We love magic. We really like simple solutions, right? Do something easy. Do something simple before you do something complex. But when it comes to medicine, because it's very, very difficult to understand. I mean, it takes a lot of training to do what we do. I went to college 11 years. Fortunately, I got 3 degrees. I did a 4-year residency, a 2-year fellowship. And then on top of that, it was another 5 years before I got both my board certifications. Okay? And now, after 32 years of practice, how many thousands of hours have I spent looking at all that stuff up there? I don't want to know the number. And you know what? I still have a lot to learn. So it's very, very easily to try to come up with just the simple solution. But remember, how many billion was that they make? That's a lot. I think it's like 40 billion. Okay. But actually, solutions can be pretty simple. we put the phone down, push away from the table, and go to the gym. Eating a balanced diet and exercising and maintaining a normal weight are not glamorous. It's not easy. A lot of times maybe not so much fun, but they work really well. And that's actually what we need a lot more of. We need to look ourselves in the mirror and say, what can I do to make myself better? It's not going to come in a little jar. It's not going to come in the form of a pill. It's going to come in the form of our own self-determination to make ourselves better. So, I'm not going to go into any specifics on any particular supplement, but if people have questions, I'm here to answer. So, more than anything else, I wanted to inform you about the supplement world and where we need to go. The vast majority of us do not need any supplementation at all. You just have to have a reasonably ballpark diet and exercise to some degree. Yep, if you have a certain deficiency, vitamin D deficiency, vitamin B12 deficiency, sure, you got to take those. But you know what? You're going to be getting them from reputable sources. Okay? But just randomly taking stuff, that's a formula for disaster. All right, what do we have?
How many questions? Well, wait. Can we ask about specific supplements?
Sure.
Yes. Okay. Good afternoon. Do you have a recommendation on a brand of prenatal vitamin for infertility? How do we know which brand to trust?
I think it's a great question because the vitamins, especially prenatal vitamins, get more supervision than anything else because they're going to pregnant women. I believe that really most of the prenatal vitamins are relatively equal. There's a lot of talk about the DHEA and all that, and that's fine. But really the most important part of the prenatal vitamins are the folic acid, because that's well established to reduce the risk of spinal cord defects. So I don't think there's any one particular brand greater than another one. I think they're safe. The fact that they throw prenatal in there throws supervision onto them. So I'd feel comfortable with just about anything. But it's really the folic acid that's important. They have iron in it because the idea is you become anemic during pregnancy. So people are trying to say, well, take some iron to do that. But that upsets a lot of people's stomach. So if your prenatal vitamin's upsetting your stomach, just go with the folic acid. You need about 800 micrograms to 1 milligram a day. So hopefully that was helpful.
Okay. This gentleman's wife is breastfeeding, and he's wondering if it's okay to take CoQ10. And if so, how much? She wants to start taking it again due to egg quality issues.
Okay. Joel, the answer is yes. I think it's very reasonable to do. Coenzyme Q, let's talk about that a little bit. Coenzyme Q is a cofactor, that's how I got the name, coenzyme, that is very important in the function of our mitochondria. Now remember that our mitochondria are the cellular powerhouses of our body. They make energy for us. And as the eggs get older, the mitochondria don't work as well. And it's turned out with very, very elegant basic science research that they're deficient in coenzyme Q. And this very elegant research also demonstrated that replacing the coenzyme Q was very helpful to these genetically modified mice. Now, how helpful is coenzyme Q in people? A little bit maybe. The data are mixed. And I think what the problem is that there probably are people that coenzyme Q really does help. And then there's a bunch of people that it's not going to help in terms of helping egg quality. The reason is this. There are other problems that are happening in the egg. For example, the telomeres, the ends of the chromosomes, are being shortened. Well, coenzyme Q is not going to fix that. And if the telomere is shortened enough, cell division is going to stop. The spindle apparatus that pulls the chromosomes apart gets damaged. That's like cutting the strings out in a marionette. Oops, there goes right arm. Oops, there goes the left arm. Oops, there goes chromosome 7. Okay? Coenzyme Q is not really going to fix that. But I think if you've got somebody that their primary issue is in the mitochondria, I think it can be helpful. I've certainly seen some people that benefit. I think the majority probably don't get that much help from it. Now, there's very good scientific data in human that shows that it can be helpful for diabetic neuropathies. and other certain pain syndromes. It also can be helpful to some degree in the heart as well. So the dosing, and that's where, like for my talk on reproductive aging, and I was looking at coenzyme Q for side effects, the dose that is recommended in fertility circles is 200 milligrams 3 times a day. Okay? It needs to be in oil. If gummies, powders, tablets, you're wasting your time. You're not going to absorb it. It has to be in oil to be absorbed. Okay? I mean, why are those other ones even out there? If I know it has to be in oil, the scientists know it's got to be in oil, right? But yet, we've got gummies and tablets and powders. And so if there's even coenzyme Q in it, you're not going to get it absorbed. The oil is kind of cool. It's an orange oil. I found that out the hard way. I had a little capsule of it, and I thought, oh, gee, this is very nice. It's a nice orange capsule. And I'm a Tennessee graduate, so I like orange things. But I said, I wonder what the oil looks like. I want to prove it as well. So I cut it in half, and the darn oil is orange. And so it took me quite a while to clean up my bathroom sink from that orange oil, I will tell you that. So don't cut it open. The oil is in fact orange. But it's got to be oil-based. So 200 milligrams 3 times a day. Look for a brand that has something on it that says they have been inspected by an outside agency. Okay? There'll be a little seal or a little box on there. One example, let me just see if I can find this in my talk. Yeah, is USP, the U.S. Pharmacopoeia. There are other things. AGEA Seal, Banned Controlled Substance Group, Consumer Labs, Informed Choice in Sport, National Sanitation Foundation are all places that do testing of things. And so if you've got something on there that says, yeah, this company invited these people in to test us, you got a pretty good chance that that's going to be what's on the label is going to be in there. Okay, so that was a little bit long answer. I hope that's helpful. But I don't think the coenzyme Q is going to be harmful to the baby, because by the time it's getting into her body, little to none's going to get to the baby, and if it does, I don't think it would be hurtful. Okay, hopefully that was helpful. That's a long answer. I'm sorry about that. All right, what else do we have?
I think that's it for now.
Okay.
Yeah.
Anybody else? Any questions? All right. Well, I want to thank all of you for tuning in, and I hope this was helpful. And I would hope that you have a good night. And as we start to head into spring, I hope you have a great spring. Thank you very much.